Hi, my name is Lourdes Matos. I work in Lisbon Hospital, Curri Cabral in Portugal. The title of our study is Comparative Cyto-histological Genetic Profile in a Series of Thyroid Indeterminate Nodules. Ultrasound fine needle aspiration cytology, the gold standard method to distinguish benign from malignant thyroid nodules, is the most accurate, cost-effective, and minimal invasive preoperative test aiming to resolve patient management. However, up to 30% of fine needle aspiration are classified as indeterminate nodules, making difficult to avoid unnecessary surgeries in this case. Molecular tests may contribute to refine the preoperative distinction between benign and malignant nodules. The aim of our study was to compare the cytohistologic genetic profile by using a paired series of cytology and histology samples to establish whether the molecular profile defined by fine needle aspiration is reliable to further characterize indeterminate nodules. Our series was composed by a cytology and corresponding histology from 85 patients with thyroid indeterminate nodules that underwent surgery. The genetic alterations were examined by PCR, followed by DNA sequencing. The association of the genetic alterations and clinical pathologic features was evaluated. Of the study patients, 87% were females, and indeterminate nodules in cytology correspond to 17.6% of benign lesions in histology and 82.4% of malignant lesions in histology. Among nodules with benign histology, only one case presented HRAS mutation in both cytology and histology. Mutations in cytology and malignant histology specimens were presented in 31 cases of 70 cases. 14 cases presented mutations in both paired cytology and histology. Mutations frequency in cytology and malignant histology specimens were respectively for TERT 2.4 versus 8.2, BRAF 2.4 versus 8.2, NRAS 3.5 versus 4.7, HRAS 8.2 versus 15.3, KRAS 2.4 versus 3.5. 7 cases with paired cytology histology presented HRAS mutations. A good cytohistologic agreement was obtained for molecular alterations, 96.3%, with a Cohen index of 0.56, moderate, considered moderated, suggesting that fine needle aspiration can contribute to anticipate the molecular profile of indeterminate nodules. Several statistically significant associations between the clinical, pathological, and molecular features of the tumors had been already found in a series of differentiated thyroid carcinomas with 231 cases that included the series of indeterminate nodules. TERT and BRAF mutations were associated with aggressiveness, and on the contrary, RAS mutations were associated with a better patient outcome.